I think good communication is much more than just what you say. It's how you are as a human being, as a professional. So it's whether you stand or sit down, it's the look on your face.
Good communication was people knowing us as individuals and knowing when and where and how to have those conversations because they'd built up that relationship with us. Sometimes we also saw people that we hadn't met before, but they'd done enough reading maybe or finding out about us to be able to use the same approach.
The worst thing is giving bad news when and where. Did you agree with that?
Yeah. We're okay at knowing when death is imminent, I think. The problem is knowing when death might be within a few months to years,
Yes.
and using that opportunity to talk about it.
I think there's something about the conversations that people need to have generally when people are well about death and dying. You know, we make birth plans, we have midwives, we all know when somebody's going to give birth, we all know that everybody's going to die at some point, but often we don't have those conversations.
If you're going to have a conversation that's likely to be distressing, have that in a planned way. So you pick the right time, you make sure there's proper privacy, you make sure that other people who might need to be part of that or might need to be around to support them after you have that conversation are there.
I think ideally you want to be in a private place where no one can hear, apart from the people in the room, what's being said. In reality, Sanjay, my job in a busy hospital, almost all my Breaking Bad news is done behind a curtain. For me, it's something about acknowledging to the people there, I'm sorry, this isn't ideal. Getting all the other things right if we can. So are the right people here? Is this the right time? Are you comfortable to have this conversation?
Seth was given a terminal diagnosis in between me leaving him at 4 o'clock from one visiting time to returning at 6 o'clock. When I came back, Seth explained to me what he'd been told. There was really nobody there at that point in time to ask questions of, nobody really to support me.
When you can relate to the situation that you're dealing with in front of you and something about it gets under your skin and you feel the emotion of it, that can be challenging, but also that's about the human connection. So that can also be really good.
I remember when the OT had come round to our house and had suggested strongly that we move to downstairs living because by this stage it had spread to Sally's brain. And I was saying, well, please, can we get a stair lift put in for upstairs? And she said, no, we don't recommend stair lifts for people with secondaries in the brain. I said, well, what do you mean? What would be the problem with that? And she said, because people can have fits and get very aggressive and stuff. And I looked at her. I said, you're joking. She went, oh, no one's gone through this with you. And I said, no, they haven't. And she looked at me and I looked at her and I said, this is just too frightening. And she said, I know it is, but this is what we're here for. She realised that I wanted more than anything Sally to be safe. And she used that as the in to have conversations with me about stuff.
Mm-hmm. One thing that did help me was a very sensitive nurse that took the time to actually listen and even wipe the tears, from my face. Emotionally, she really made a difference.
Checking for understanding can be quite difficult. The technique that often people are trained to use is, can you repeat all of that back to me? But that's very, very daunting. And
That's horrible.
If people are upset,
Yeah.
then it's an awful question to ask.
That's a test.
I think it's easiest to be done over subsequent conversations. So if you're seeing a patient and then you're going back to see them the next day, seeing what questions they've developed over the day, if they remember any of the conversation from the day before, and you can judge that by what they're saying to you rather than asking them to reel back the medical terms.
I imagine it's probably hard for patients to ask doctors whether they really know what they're doing or to ask if they can stop a certain kind of treatment, particularly towards the end of their lives.
I think a lot of the sort of broader social and sort of psychological questions sometimes aren't asked in terms of impact on what happens. Some of the practicalities are covered, but often the impact of bereavement, what happens afterwards, those sorts of questions aren't asked.
When you can have the whole pathway towards the end mapped out in a way that you can understand it, that you're being treated like a human being, that someone's with you and alongside you, and they share their professional interest in looking after your person as much as you do, you can't do any more than that. So
actually, Claire, you could be the communication model for doctors. No, but I don't make just to make a joke. But it has made it easy for me to talk about subjects that I am still learning about. So thank you.
thank you.